Bacteroides fragilis are obligate anaerobes. They gram-stain negative and appear rod-shaped. They are bioresistant, non-motile, non-spore-forming, and encapsulated. Biochemically, they are catalase positive, indole negative, urease negative, and esculin hydrolysis positive. The species is named fragilis due to colonies appearing small and brittle when cultured. Why do we care about Bacteroides fragilis? They can be found living within a variety of animals, including humans, dogs, and cats. They are a common commensal bacteria that ferment carbohydrates, producing short fatty acid chains as waste that can then be used by the host. B. fragilis is part of the normal human flora, making up about 0.5% of the bacteria found in the colon. Other locations it can be found include the mouth, the GI tract, the female reproductive tract, and mucosal membranes. In addition, B. fragilis helps with maturation and regulation of the host immune system. Specifically, it produces polysaccharides that activate T-cell-dependent immune response, limits pathogen colonization in the GI tract, and facilitates gut development. Despite the good, normal functions of B. fragilis, it may act as an opportunistic pathogen. B. fragilis infects people with compromised epithelial cells. Potential causes include gastrointestinal surgery, internal trauma, inflammatory bowel disease, colon cancer, and human or animal bites. Infections are most common in people who are immunocompromised or people that suffer from chronic diseases such as celiac disease. B. fragilis does not discriminate. It can infect anyone, male or female, at any age, from infancy to adulthood. Adults are more likely to get infections because they are more likely to undergo surgery or suffer from chronic disease. Additionally, patients in hospitals are at risk for nosocomial infections. B. fragilis accounts for 45 to 65% of nosocomial bacteremia infections.
Host target sites include the head, skin, neck, chest, abdomen, pelvis, and the central nervous system. Bacteroides fragilis is associated with polymicrobial infections, intra-abdominal sepsis, appendicitis, gynecological infections, skin and soft tissue infections, pelvic infections, endocarditis, which is inflammation of the heart valve, pericarditis, which is inflammation of the sac-like membrane surrounding the heart, and although rare, cases of meningitis have been reported. Host defenses include our epithelial barrier, innate immune system, elevation of host cytokine levels, and response by leukocytes such as macrophages. Virulence factors of B. fragilis include a capsule which helps it avoid the complement system and phagocytic uptake, enterotoxin which causes the loss of tight junctions in intestinal epithelial cells, pili and fimbriae which help with attachment, and has the ability to modulate surface polysaccharide, which helps it evade host recognition.
Symptoms include abscess formation in various parts of the body, including the lungs and abdomen. Abscess can rupture and the bacteria can enter the bloodstream. Stomach pain, fever, and soft tissue infection are also common symptoms. They are gram-negative rods and catalase positive. Because they are obligate anaerobes, they must be cultured in anaerobic jars. They are stimulated by bio and can be isolated on bioesculin agar, which is also differential for esculin hydrolysis and causes browning of the agar. The bacteria is resistant to kanamycin and vancomycin, as indicated by growth on kanamycin and vancomycin blood agar.
Bacteroides infections can be treated with specific antibiotics, chloramphenicol, clindamycin, and metronidazole. Abscesses and necrotic tissue should be drained or removed. Because it is an obligate anaerobe, any exposure to oxygen will instantly be toxic to B. fragilis. Thus, hyperbaric oxygen therapy can be used to treat skin and soft tissue infections. Bacteroides fragilis has gained resistance to other common antibiotics by producing enzymes called beta-lactamases which break them down. It is resistant to penicillin, cephalosporin, and tetracycline. So how can we prevent Bacteroides fragilis infections? There is currently no vaccine. However, nosocomial infections can be prevented by prophylactic use of antibiotics before gastrointestinal surgeries and overall good hygiene in hospital settings.